Thanks, Abby. Our third speaker is Hendricks Brown, who is from Northwestern University Feinberg School of Medicine, and he also directs a NIDA-funded Center for Prevention Implementation Methodology.
Thank you, Denise, and it's really delightful to be here with this group. I wanted to talk over the next few minutes in here about overcoming some of the barriers for effective implementation of prevention programs. Some of those will be related to bullying, but it will be mostly related to other externalizing behavior, and I just turned it off. I did want to acknowledge NIDA to begin with in here, the P30 that is on the Center for Prevention Implementation Methodology, as well as a number of R01s. One of the ones we'll mention in here has to do with the ongoing implementation trial going on with the Good Behavior Game directed by Gene Poduska that's supported by NIDA. And also, this also happens to really focus around what the partnerships are that we need to have to develop and implement effective programs and have them sustained over time. And SAMHSA has been we've worked very closely with SAMHSA in a partnership that involves 4 of the programs that we've listed here that are prevention programs that cross both the Center for Substance Abuse Prevention and also CMHS, Center for Mental Health Services in here. And we think that the kind of modeling of the behavior of the researchers in developing these kind of relationships with the large service organizations as well as the local service organizations is a fundamental part of where we're going to go if we're going to move programs into practice. And I think we've had both Abby and Luann have talked a little bit about that. I'll talk about that as well. So here's the similar diagram to what Luann had put up. I think it was worthwhile to put this up again because it's fundamental to look at the different stages of research as we move from a program where we do these small, precise efficacy trials under optimal conditions. Those are really looking at could a program work? Second one under effectiveness, which is what I'll give a couple of examples on, is does the program work? With a good deal of help and support from the research organizations to support that. But what we're really talking about in here is this other level in here of dissemination and implementation studies, mostly implementation. And it has sometimes broken up into 4 categories like this in terms of exploration, adoption, implementation, and sustainment, sometimes others. But it's really about making a program work. How do you actually do that in the ground? There are 2 levels of that kind of work that you can think about in here. One of them is sort of the depth of this box in here. One is that from a scientific point of view, can you look at implementation as producing generalizable knowledge? That is something that you could take from that particular study and extend and expand to other projects. The other question is this local evaluation. Can you actually get it to be done locally, which is what you want to have done? We think that those can be done in complement, and they're useful to try and think about, but they're obviously from different perspectives of one more important than another. So I'll talk a little bit about some of the implementing prevention programs in schools, and particularly look at 3 challenges in here. One of them has already been mentioned once in here this afternoon, making prevention an integral part of the school mission, particularly looking at sustainability from the very beginning rather than it's a last step that you do in the work in here. Second has to do with delivering programs that address multiple prevention targets. I don't think that we're going to be able to focus on individual level program outcomes and make our success in here. I think we have to have some broad-based programs that go across these. I'm going to give a couple illustrations of 2 programs that have multiple sets of outcomes that we know about, the Good Behavior Game and Familias Unidas. The third thing in here is the fundamental piece that both Abby and Luann talked about in here of fidelity. I think in terms of the prevention systems, when you go into schools, schools are what we call normative organizations, that it's set up for everybody to attend in here. They're usually not set up to do the really detailed kind of work on doing the fidelity assessments within those organizations, and they need some help in trying to make that simpler, easier for them. And so we've been looking at ways of doing this one with computational linguistics. So those are the things I'm going to talk about in here. I wanted to mention first the REAIM model. This is one that Russ Glasgow and colleagues put together a number of years ago. I think it's a really useful one. He listed 5 things that are important for implementation. Going into the population, making sure that the population is exposed is large enough, making sure that the program does work on the outcomes it's intended, that's effectiveness. And then 3 things in here: do the organizations themselves take it up? Is the program delivered with fidelity? And is the program sustained over time? And essentially, the effects of the intervention over time is something like the product of all of those. So if you have one of those that doesn't do very much, if you have very low proportion of the population in here, you're not going to get much of an effect at a population level. So all of those, I think, have to come in, and we're trying to do multiple things with implementation at the time, which makes it challenging to do. So here's the first part of this one: making prevention an integral part of the school mission. So the way we started off this kind of work in here is built on a model that Shepard Kellum put together in a special issue that Catherine Bradshaw organized 2 years ago already for administration and policy and mental health. And Shep has been our long-term colleague and leader for much of the work that he's done in Baltimore trials and other places. And what he calls partnerships are the foundation on which public health is built. We can't get to where we want to go unless we have an active, integrated partnership. The kind of partnerships we're talking about in school systems is the school district that includes not just the superintendent, but also the school board above that, because the superintendents in urban settings typically last about 18 months before they are fired or moved to someplace else. So every structure that you have put in place in there, if that depends upon that particular superintendent, will not last if you don't have structures that support you going back above that level of the superintendent. Community organizations, as Abby talked about, are the key factors to make sure that you hold schools accountable for what they can do and provide the necessary needs for those communities that they live in. And the researchers and policymakers have important roles here. And I wanted to talk a little bit about the role of the researcher. When Shep wrote his introduction to that special issue, he wrote down 10 statements, and I'm just going to start with a couple of these statements in here, but I'd skipped a number of them for a purpose. One of them is to start and analyze the agencies and community organizations where the support is required to start off with. Who's going to keep you in there? Who are those organizations that are going to kick you out unless you have them on your side? Determine the order of engaging with each of these leaders, work with them individually, and then when trust is established, find ways to bring them together if this is not already done with some of the community organizations. This is the kind of work that the communities that care kind of model would look at in here. It's a little slightly different from the communities that care, but one of the things it shares in there with the communities that care is it doesn't come in with, I've got a research project that I need you to do this intervention. And that's not the way to try to work and collaborate with schools. The way to work with them is to start saying, what is your mission, and be very clear about what that kind of 5-year plan looks like for them. It's going to obviously be related to how they work together with impact on achievement for those kids and learning. And how does a prevention program fit within that context? How could it might be fitted in there? Number 9 in here is the role around the researcher, and that's deliberate, that it's very long discussion in here in terms of that kind of process of taking the intervention programs leader's role as that of a technical scientific staff leader with the community board sitting as overseer and advisor to ensure community values and service agencies guidelines are protected. And that's the way to sustain it. That's at least the only way that I know about it. And if you don't start this way, you'll be kicked out pretty quickly, or it's very likely that you'll be kicked out, particularly when the funding dries up. And the sustainability issue is one of the main issues, and SAMHSA was the one that directed us to look at this kind of a model of saying sustainability of their programs after the federal funding goes away is the key issue for them. So that's what we've been interested in looking at. I want to move towards programs that have multiple outcomes in here. A number of you in this room have worked with the Good Behavior Game as one of these. I'm just trying to list in here a couple of the outcomes that we know about in here that we've measured very carefully with some randomized trials. I also wanted to put in complement in here about Familias Unidas, which is an intervention that was developed by my colleagues at the University of Miami for Hispanic families, for Hispanic adolescents. Both of them have very strong impact on reducing level of drug use, HIV risk behaviors, increasing the condom use for those, and reducing unprotected sex, and particularly around the use of having sex with unprotected sex when people are using drugs, depressive symptoms, suicide attempts, and other areas in here. So it's a very broad kind of base in here. This is analysis of mediational effects in here that look at one outcome, that is a diagnosis of drug use 13 years later. So as Abby was talking about, we're talking about long-term developmental outcomes for many of these preventive interventions. In the middle here are the behaviors, some of which you are interested in here. The fighting, for example, these are ratings by peers about who are the kids in your classroom who fight a lot. Off-task and aggressive disruptive behavior are measured as observations in the classroom, and teacher ratings are the last one of aggressive behavior. And all of the coefficients on the right side in here, these are standardized coefficients showing how much major impact this intervention has on each one of those in first grade, by the end of first grade. And on the right hand is the long-term impacts on distal outcomes such as drug use. The one last thing I wanted to talk about in here is about how do you think about looking at whether a program, how a program should work. It really needs, as we were indicated in here, the high fidelity, and it also needs participation in the target population in here. In school-based interventions, the population is relatively captive, so that's not as important, but certainly the fidelity is. The arrows that are going back in here correspond to feedback mechanisms. So if you had that information of monitoring fidelity, you can't just monitor it, but it has to be coming back to those who are delivering those to the intervention agent and agency. The problem is that schools don't have the resources to develop or maintain the fidelity monitoring or feedback systems. It's too costly in here. So we took an example of a program that was being funded by NIDA in an effectiveness trial. This is Familias Unidas, which is a parent-based intervention. It was developed through the school systems, to be delivered through the school systems by school counselors. And they would have groups of Hispanic parents get together and have group sessions, and then they would have parent sessions. And I'm going to focus on these family visits at the home. In the current study, the money for looking at fidelity and putting that back as a feedback loop to try and look and make sure that the school counselors were delivering the program with fidelity was extensive. And you'd expect that in an effectiveness trial. But you can't do that in an implementation trial. You can't take away money from the schools who are going to be delivering these services in here. So we wanted to try and look at a full-scale, cost-effective way of trying to work in this one. And we chose one particular area of fidelity of this intervention called joining. This came from a family-based intervention family therapy kind of intervention moved into a prevention model, so the joining or engagement part of it was a key thing. It's common to all of the kinds of interventions we normally do. Ordinarily, what we do is take the human ratings at the video level, 30 minutes of video observations to assess a fidelity coding with some standardized in here, and then use that for monitoring. This is the system that we've been starting to look at as a proof of concept. Instead of going this up route at the very top of the page where we'd use 8% of the audio tapes, you could use 100% if you could find ways to use the computational ways to monitor what's actually happening in there. And that's using tools of computational linguistics and other areas in here. So these are machine ratings in here. I'm not going to go to too much of the detail in here, but to give you just sort of a flavor, here's some of the things that you want a therapist to at least be aware of. Making statements like the child says, I like sports. The therapist says, yes, no questions. Do you like sports? Those things can be broken down in computational linguistics terms, in terms of structures of those questions. But you'd want to move the therapist to doing things like open-ended questions, like what do you like about sports? So one of the things about this joining is to try to make sure that the people are asking open-ended questions. Can you actually do that in a computer system in here? So Carlos Gallo in our group has been working on that and has used decision trees like this after you can use and screen these things, and gotten very good reliability in here. The utterance level ratings for human against a machine is a cap of about 0.83, which is almost the same as it is from one human to another. So this is a proof of concept. It's not the whole thing here, but it's one of those kinds of ideas that we think ultimately can help and support this. Here's how you would be using it in practice. You get things like family attendance, satisfaction, where they are and where the implementation strategy is altogether in here, but you also can get utterance level fidelity ratings, use that as a machine level classifier in here, and assess whether there's good fidelity and poor fidelity. You can probably do that pretty well, but what's left over in here is the uncertain kind of issue, and that's for the supervisor. So this is just my summary in here to look at these things, to make prevention an integral part of it, make sure that it's part of the primary mission, to deliver programs that are multiple prevention targets in here, and then use tools like a computational approach in here to help and improve the cost effectiveness of a fidelity monitoring system. So thank you very much.